Can GDNF be used to treat Parkinson's disease? Have you ever wondered if a protein called glial cell line-derived neurotrophic factor, or GDNF, could be a game-changer for treating Parkinson's disease? This protein plays a crucial role in supporting the survival and function of dopaminergic neurons, which are the brain cells that degenerate in Parkinson's disease. Because of its protective properties observed in lab studies, researchers have been investigating GDNF as a potential treatment to slow down or even reverse the progression of this condition. In the early stages of research, some small clinical trials showed promising results. In these studies, GDNF was administered directly into the brain, specifically in an area called the putamen, which is significantly affected by Parkinson's disease. Some patients reported improvements in their motor functions and even showed signs of dopamine fiber regeneration. Interestingly, a few individuals experienced lasting benefits even years after their treatment ended. However, it is important to note that these findings came from limited sample sizes, and further independent studies are needed to confirm these results. More recent, larger clinical trials have not shown a statistically significant improvement in Parkinson's symptoms for those treated with GDNF compared to those receiving a placebo. While brain imaging indicated some positive effects on damaged brain cells, the clinical improvements were not strong enough to meet the primary goals of these studies. Additionally, some patients developed antibodies against GDNF, which could impact how well the treatment works. One of the significant challenges with using GDNF as a treatment is delivering it effectively to the brain. Since GDNF cannot cross the blood-brain barrier, it must be directly administered into the brain through surgical implantation of infusion devices. This method is invasive and carries certain risks, making it difficult to implement widely. Researchers are also exploring alternative delivery methods. For instance, gene therapy could potentially encourage the brain to produce GDNF on its own, while intranasal administration might help bypass the blood-brain barrier. Although early studies on these methods are in progress, they are still experimental. As it stands, GDNF is not an approved treatment for Parkinson's disease. While it holds promise due to its neuroprotective potential, the results from clinical trials so far have been mixed and inconclusive. The scientific community is actively working to find the best ways to deliver GDNF safely and effectively, while also assessing whether it can provide meaningful and lasting benefits for individuals with Parkinson's disease. If you are considering GDNF therapies, it is essential to consult with your healthcare provider. Keep in mind that these treatments are still experimental and not part of standard care for Parkinson's disease. Current management typically relies on medications and therapies that have established safety and efficacy. In conclusion, while GDNF has shown potential in early studies as a neuroprotective agent for Parkinson's disease, larger and more rigorous trials are needed to determine its effectiveness as a treatment. The research continues, aiming to optimize delivery methods and evaluate long-term outcomes before GDNF can become a standard option for patients.